On average, women take about 7 to 10 years before getting a diagnosis of why they've been struggling with period pains. Often, this diagnosis will eventually be known as endometriosis. To date, the data is clear that the struggle for women continues and there is often a delay and dismissal of their menstrual pain. Women continue to struggle with these symptoms throughout their lives with these symptoms. What symptoms do women with endometriosis struggle with? Often they start with menstrual pain that starts to affect their ability to function on a daily basis. This pain also affects their ability to pass urine, sometimes even affecting their ability to open their bowels. A proportion of women struggle to conceive, and a proportion of women also have pain during intercourse. As the pain progresses, this affects more beyond the days of their period, often starting before the start of their menstruation and even prolonging after menstruation. As they seek help, menstrual pain is normalized and they are told that this can be a normal part of growing up. Clinical examination for menstrual pain starts with a basic gynecological examination to look for signs of pelvic or abdominal tenderness. We call this site-specific tenderness. However, this is limited and can be also intrusive and often inconclusive. The lack of specific site-specific tenderness or the lack of abdominal pain does not negate the fact that the woman struggles with period pain. The advancement of ultrasound and the advancement of training in ultrasound means that today we are able to diagnose and detect endometriosis early on with ultrasound. In the past, the belief was that surgery or invasive techniques were required to diagnose ultrasound. But the international body has recognized that ultrasound is specific and sensitive enough to diagnose endometriosis, even with peritoneal or often called superficial endometriosis. More so with deep endometriosis that affects the bladder, the bowel, the ovaries. These are all deep endometriosis that can be easily detected with ultrasound. For those in whom an ultrasound scan is not suitable or who are unable to tolerate an ultrasound scan, an MRI of the abdomen and pelvis would be more than sufficient to detect deep endometriosis. This often requires a two-pronged technique, a discussion between the endometriosis surgeon and the radiology consultant to understand the presence of the disease, the location, in order to diagnose the endometriosis accurately. The MRI is also helpful for surgical planning, often for those women who go on to have surgery for endometriosis. The MRI can be used to discuss it with the colorectal surgeons, the urologists, and the endometriosis surgeon to plan the appropriate surgery for the patient. Therefore, in those who are planning surgery, we often advocate for an MRI prior to them having the surgery performed. For years, laparoscopy has been considered the gold standard in diagnosing endometriosis. This is intrusive, invasive, and often unnecessary. This is also because for endometriosis of stage 1 and stage 2, the evidence is still unclear if surgical excision will confer adequate benefit. So we know today that imaging in expert hands, such as ultrasound and MRI, is sensitive and specific to diagnose endometriosis. We need to together debunk the myth that surgery or excision surgery or histology, which is tissue diagnosis of endometriosis, is required to actually truly diagnose a woman with endometriosis. Today, it's internationally accepted that women can be diagnosed with 1. An ultrasound scan by an expert in endometriosis, an MRI with expert recognition, or even with suppression or medical treatment that improves their symptoms. These are all ways in which the international body has agreed that endometriosis can be diagnosed. Let's together debunk the myth that menstrual pain is normal. The normalization of period pain that appears to be told to improve with increasing age or pregnancy is untrue. For those who struggle with menstrual pain, you do need to get this checked. You need a diagnosis of why menstrual pain is happening, because there are adequate treatments that will improve your quality of life.